So good to see you again. Thank you very much. Good afternoon to everyone. Let me welcome my fellow governors who are on the telephone, who you'll hear from in a moment. We have Governor Phil Murphy from the great state of New Jersey. We have Governor Ned Lamont from the great state of Connecticut. Governor Tom Wolf from the great state of Pennsylvania. Governor John Carney from the great state of Delaware, and Governor Gina Raimondo from the great state of Rhode Island. I want to thank them for their professionalism and the way they've been handling this situation respectively. I also want to thank them on behalf of the state of New York for their good work in working with us through this very difficult time. Their mutuality and partnership and cooperation has been of great benefit to the state, so I want to thank them for that. I'm going to make some opening comments and turn it over to Governor Murphy first, and then we'll hear from the other governors. I think most states, operator, we're ready. Started hearing music. Okay, thank you, governors. I just said I thank you all very much for your professionalism and your cooperation and everything you've done that has benefited the alliance with the state of New York, and I also want to thank you and congratulate you on what you've done for your states. It's truly been outstanding, and it's my honor to be a colleague to you. We've been talking today about the fact that New York believes we have reached a plateau in the increase of number of cases. They're not going down, but they're not going up at the same rate, and we believe it's a quote-unquote plateau, and that is relatively good news in a world of bad options. And we should start looking forward to reopening, quote-unquote, but reopening with a plan and a smart plan, because if you do it wrong, it can backfire, and we've seen that in other places on the globe. So everyone is very anxious to get out of the house, get back to work, get the economy moving. Everyone agrees with that. What the art form is going to be here is doing that smartly and doing that productively and doing that in a coordinated way, doing that in coordination with the other states that are in the area, and doing it as a cooperative effort where we learn from each other and we share information and we share resources and we share intelligence. No one has done this before. No one on this telephone has done it before. No other state has done it before. So it's one step forward after research and consultation with experts. I'm not a public health expert, but this has to be informed by experts and by data. You take one step forward, you see how it works, and then you measure the next step. And to the extent we can do that together, that is the best course. There's no doubt about that. I don't believe we wind up with a fully common strategy. You have different states in different positions. Within this state, you have different areas with different circumstances, and the plan has to fit the facts and the circumstances. It's one situation in New York City, it's a different situation in rural counties, different situation in suburban counties. So how do you address those different set of facts? And I want to make sure all the people we represent make sure that we are smart in the way we are doing this. Yes, we've never been here before, but that doesn't mean you can't ensure public confidence that you're doing everything you can to do it in a smart way, an informed way, guided by experts and data and science, and not in a political way. And I think working together, we can do that. Each state is going to name a public health official for that state, an economic development official for that state. Those officials and the chief of staff of the governor of each state will then form a working group that will start work immediately on designing a reopening plan taking into consideration the public health concerns and issues and the economic reactivation issues and concerns. Study the data, study the research, study the experience of other countries, and give us guidelines and parameters to go forward. Again, we anticipate different facts, different circumstances for different states, different parts of states, but let's be smart and let's be cooperative and let's learn from one another. And that is inarguable. With that, let me turn it over to Governor Phil Murphy. Governor Murphy, thank you so much for being with us.
Governor Cuomo, thank you for hosting us so graciously, and in the category of you're known by the company you keep, I'm honored to be with you and Governor Lamont, Governor Wolf, Governor Carney, Governor Raimondo in this discussion and in this initiative. You know, just as we harmonized as states, you know, New Jersey's the densest state in America, and we're in that corridor that is so unique, and it was imperative to not just do the things that we needed to do within our four walls as we closed our state down, but to do it in close coordination with New York and Pennsylvania and Delaware, Connecticut especially. And it's that same spirit that we're coming together and acknowledging as we, whenever it is, and by the way, we have not yet plateaued. We're a couple of beats behind New York. Our positive tests have begun to flatten, but we're not yet there. But as we, you know, whenever it is that we determine based on the facts, the data, the science, that it is safe for us to responsibly begin the reopening and all the healthcare infrastructure that goes with that, to do that in coordination seems to be an overwhelmingly prudent approach. And we're honored to be very much a part of this group. We do know this, that an economic recovery only occurs on the back of a complete healthcare recovery, and that order is essential. And getting that wrong, transposing those steps or jumping in too early, or maybe jumping in by ourselves. Governor Cuomo and I have talked about if the protocols on one side of the Hudson for a restaurant or a bar are different than the other, or similarly across the Delaware, you could have inadvertent, unintended consequences which could be grave. So getting this right, both the timing, the infrastructure, from as well as input, as Governor Cuomo has said, from both healthcare experts as well as economic development experts, in addition to our government colleagues, seems to me and to us to be an incredibly smart way to go. This is the fight of our lives. Let there be no doubt about it. And we're not out of the woods yet. And reopening ourselves back up will be equally challenging beyond the shadow of a doubt. So I'm honored to be with my fellow governors, as I have been every step of the way over the past several months, and look forward to that spirit and coordination going forward. Thanks, Governor Cuomo.
Thank you. Thank you very much, Governor Murphy, and you're right. We started this journey together. We're going to end it together on a positive note. Same with Governor Ned Lamont from the state of Connecticut. Governor Lamont, thank you very much. Thank you for being with us.
Andrew, thanks for getting us organized and everybody here. I'll just pick up where Phil left off. He mentioned the major transportation corridors that interconnect at least New York, New Jersey, and Connecticut as part of a tri-state workforce. And we all slowly closed down methodically parts of our economy in a way that we tried to mitigate the effects of the contagion. And we're going to be thoughtful about how we get this opened as well. But, Governor Cuomo, as you know, all of our pandemic here in Connecticut is all along that I-95 Metro North corridor, where we have hundreds of thousands of people going back and forth between New York and Connecticut. It's the commuter corridor for us, but it's also the COVID corridor, which is why it's so important that we work together thoughtfully on this. Listen to the experts, as you say, and make sure you don't pull the trigger too early. I'm looking over at Japan and Hong Kong and Singapore, and those places are unfortunately seeing a small resurgence, the second half of the V coming back again, and that would be so demoralizing for our economy. So that's why what we do, I want to do on a coordinated basis, have a database that we share, establish the same protocols so we know how we're working together, and get that information up to our down to Washington so they can coordinate as well. I mean, we're going to be thinking about the mix of PCR antigens and probably the low infection areas in terms of testing, and probably the antibody testing in those areas where it's more prevalent, so we can put together a system that allows our people to get back to work. And I couldn't agree with each and every one of you that working together makes the most sense, listening to the experts, doing this methodically, but doing it now. Back to you, Governor Cuomo.
Amen. Thank you very much, Governor Lamont. Thank you. Governor Tom Wolf from Pennsylvania. Tom, good to be with you again.
Good to be with you too, Governor Cuomo. Thank you for doing this, and thank you to my fellow governors for making this effort possible. You know, we all know that we can do anything better when we work together in this region, and we have done good things by working together. We've shared ideas and plans, and we've shared in going through this challenge. And this partnership, this council that we're forming here recognizes that simple fact. And I agree with the sentiments of my partners that we need to do this right, and that's what we're trying to do. But this partnership recognizes something else that I think is really important. It recognizes that we need to come up with a specific and a smart plan for this uncertain future that lies ahead. But it is also that we are creating a plan to let our people, the people that we serve, the citizens of our states, that we indeed do have a future. And this is as important as coming up with the specific elements of this plan. It has to be responsible, but it has to show us that we do have a future. As we figure out how we're going to reopen our schools, how we reopen our businesses and our homes, we're also going to recognize that we're trying to figure out how we're going to restore the sense of hope that this pandemic has taken away from so many of us. And I'm proud of the people who are going to be working on this for Pennsylvania, the Secretary of Health, the Secretary of the Department of Community and Economic Development, and my Chief of Staff. We're all going to do a great job for the people we serve, and I think we're going to show the people of the United States how you come out of something as devastating as this in a responsible fashion. Governor Cuomo, thank you again for doing this, and back to you.
Thank you, Governor Wolf. Thank you very much. I couldn't agree more with what my colleagues are saying, and Governor Wolf's point. We talk about the economic toll, which you can quantify. You can't quantify the emotional toll this has taken on people. And I think Governor Wolf is exactly right. Knowing that there's another day, a new day coming, may be different than past days, but it can be a bright day. And that is true, and we have to focus on that. Governor Carney, very good to be with you, John. Thank you very much for taking the time and all the help and all the coordination. Governor Carney?
Yes, can you hear me now?
Yes, I can. Yes, we can, John.
Hello, can you hear me now?
Yes, we can.
We can.
Well, sorry for that little glitch. I want to thank my colleagues for this cooperative effort, especially you, Governor Cuomo, for bringing us together, and frankly for your leadership on a day-to-day basis under very difficult circumstances there in Metro New York City and your state. Have been providing great leadership there and across the country, and we certainly appreciate that. Certainly thanks for including Delaware. We are on the southern end of this region, but we're connected importantly by the I-95 corridor and the Amtrak Northeast region, and so in a very important way, we're part of the region, if only a small part. We have seen the connections among our states through this, as many of the folks who work in our state live in Governor Wolf's state or across the river in New Jersey, and they've obviously had to balance the various provisions and restrictions in each of our states. So this will help us as we think through what it takes to re-enter and to get our economies moving again. Frankly, it'll really just formalize for me what I've already been doing along with Governors Murphy and Wolf in our Metro Philadelphia area, as we talk on a number of occasions about decisions that we've had to make in terms of shutting down businesses, in terms of business and supply chains that are connected among our states. This will formalize that and really put before us all the decisions that we have coming ahead of us, and I think maybe even more difficult than decisions on the front end of this over the last month and a half, 2 months, as we get on the other side of the peak, which it seems like the greater New York City area is reaching now. How do we open things in a way that's safe? I heard Governor Murphy say yesterday that we need to get the patient healthy before we can get the economy healthy, and I think he's exactly right in that. And so working together, our economies are connected, our states are connected in a real way in terms of transportation and visitation and the rest. And so our working together, sharing our information and intelligence, I think will help each of us make better decisions. So I want to thank all of you for your leadership. This is a time we're experiencing uncharted waters here, and I think ahead of us will be more uncharted waters. But working together, we will do a better job for the people that we work for, and we'll make smart decisions in reopening our economy. We're a little bit different down here, a little bit behind, I think. Those of you in northern New Jersey and New York City, our message here at home still is be safe, stay at home. When you go out, observe appropriate social distancing, and we will continue with that message. But at the same time, think about the timing of reentry and getting life back to normal again if that ever occurs. So again, Governor Cuomo, thank you so much for including the first state here in the southern end of this region. We appreciate your leadership there in the great state of New York and your leadership with this collaborative task force. Thank you very much.
Thank you. Thank you very much, Governor Carney, and you're so right. We're all learning, right? This is new for all of us, and it throws out a lot of the old rules and the old ways of doing business. And the state boundaries mean very little to this virus. And somebody can get on Amtrak, or somebody can get in a car and go up the I-95 corridor. And it doesn't matter if they're from Delaware or New Jersey or Connecticut or New York or what state they're from, it can have the same consequence. So we're learning and we're growing every day. Thank you, John. And Governor Gina Raimondo from the state of Rhode Island. Governor Raimondo, thank you very much for taking the time to be with us. Thank you for working through all these issues with us on behalf of New York. Gina Raimondo.
Good afternoon. Can you hear me?
Yes, we can.
Hi. Good afternoon, and thank you all. And thank you, Andrew, for leading us and convening this group. I think it's a terrific initiative. Like all of you, all the governors who've spoken, all of the governors I've been speaking with, I am constantly thinking about what it's going to take to safely reopen our economy. Like you, I don't want to keep people out of work one day longer than necessary. However, we need to do it safely, which means we need a smart, targeted approach to slowly reopen the economy in a way that keeps everybody, most especially the elderly, the vulnerable, and those with pre-existing conditions, safe. So, like many of you, I have a team here that I've assembled to develop a plan for what we are calling the new normal. And we're looking at everything from how we screen people entering businesses to how we utilize more touchless technologies in our day-to-day interactions, doing a deep dive industry by industry on new guidelines for this new normal. And I'm looking forward to this initiative. I'm looking forward to being a part of the working group and exchanging ideas. Like you have said, none of us has ever gone through this before, and I am confident that by working together and sharing our best ideas, we will be much, much more likely to get it right for the citizens of our state and this region. I will say, throughout the crisis, the governors are the ones who've been showing great leadership and taking action to keep our residents safe. And so I think it's only appropriate that we do the same thing now by coming together and showing regional leadership to reopen the economy. And as everyone has said, I think if we take a coordinated approach on a regional level, we'll be that much more successful. I know that over the past few weeks, I've spoken frequently with the governors on this call, with the governor of Massachusetts, governors all around the country, and our ongoing collaboration, idea exchange, coordination has certainly enabled all of us to keep people safe in our states. The reality is this virus doesn't care about state borders, and our response shouldn't either. So I am fully in support of this effort and look forward to working with each of you to make sure that we do get to the business of getting folks back to work, and we do it in the smartest, safest way possible.
Thank you very much, Gina. Thank you, Governor Raimondo. And I couldn't agree more with all of my colleagues and Governor Raimondo's point. None of us have done this before. Sharing information, learning from each other, pooling resources is only smart, and we have to be smart. You need the best public health plan, and you need the best economic reactivation plan. It's not either or, it has to be both. No one is willing to sacrifice one at the expense of the other, and you can't have one at the expense of the other. But how you do it, that's the art form. We're going to take questions for one